We're tasked with changing people's lives, but we can't do that overnight, and we certainly can't do that by ourselves.
Although we're under this huge umbrella, we don't understand always what each other are doing.
Typically when we don't collaborate Children's and WorkFirst, I find that I'm searching for information that they might already have.
If we don't know that they're working with Children and Family Services, they could potentially go into sanction, lose part of their family's grant, and end up with even more barriers than they already have.
So I think not collaborating on that results in frustration for everyone. The workers are frustrated, the families are frustrated, the kids are left in limbo, and that's just not a good outcome for anyone.
If anything, you could think of it as like a puzzle, right? And so WorkFirst staff, they get a piece of the puzzle, and Children's Administration staff gets a piece of the puzzle. But if we put those pieces together, then we'll be able to see a bigger, like a more holistic view of what's going on, and I think it would benefit on a multi-dimensional level.
A client I had who was involved in many different activities. She had domestic violence going on. She had Child Protective Services case going on. She was working with us in WorkFirst. None of us could get this client to fall through with their activities. So we all came together for a good cause case staffing. And between the three of us, we were able to find out that first off, we had the client each doing separate activities. All the same activities, but we all had the client doing those activities independently. We also found out that, in fact, the client was participating in all these activities just separately. In that meeting, we were able to pare down all the activities to one plan that worked for us at WorkFirst, worked for the domestic violence advocate, and then also worked for the Children's Administration, reducing the client's stress greatly, reducing our stress greatly, and really making it much more clear and cut for the client. We also determined that she needed to move for her safety reasons. We were able to get her back on track. And as a result of one meeting, I think it lasted 30 minutes, we were able to reduce the plan to one plan, and the client was then successful thereafter.
You know, just like we build rapport with clients, I think we have to build rapport with each other.
Collaboration is important with WorkFirst and Children's Administration so that everybody is understanding what each other's doing and so that the end result can be the same.
It may seem like it takes a little extra time to collaborate with Children and Family Services, but in the long run, it's in everybody's best interest because everything moves smoother. The IRPs are done properly to match up with Children and Family Services requirements. The parent moves throughout our processes more smoothly.
As a social worker, I know it can get very stressful. There's a lot going on, and it can sometimes seem like it's not worth our time to make those little contacts. But in the end, more than likely, we'll save greatly more time just by a small email or a short phone call.
Yeah, it does take time to collaborate. It takes time to send an email. It takes time to walk over and ask questions. It takes time to track people down if they're not at their desk. But more often than not, I get really good information.
It's a time savings. We don't have to backtrack and re-look at plans that may have been in conflict with each other. When we invest time up front, we develop collaborative plans that better serve that client and have better outcomes for the child.
The best way that Children's can share and collaborate with me is whatever works. If it's email, if it's a phone call, if it's a staffing, that I sometimes invite those children's caseworker or case managers to come and join us. Whatever will work for that parent.
What it really takes is leaders creating an environment for staff in both Children's Administration and Community Services Division where people can be free and creative and open and sharing information about the common families and the common children that we're serving.
It's usually as simple as sending an email and then following up with a phone call. Email can you get a lot of information right across and right off the bat, but a phone conversation usually is a little more direct. You can get more clear information, and it really helps put everything together and really build the case that you need for that client to make them successful.
Perhaps you don't have the time to make a personal contact with somebody, but if you understand and have access to programs like eJazz or FamLink or Sims or whatever the case may be, to be able to grab that information, you know, if either side took a look and saw what the intake was about or what the comprehensive evaluation said, and then be able to, you know, look at that and say, oh, maybe I need to have another conversation with this person. It's a big deal.
And additionally, when they share information in a collaborative nature, you're going to get a more comprehensive outlook of what in fact is going on for that parent. It's not infrequent that a parent is going to be assessed and appear in one sense for the Children's Administration, but then present different issues to the Community Services Division. When that happens, then each of those case managers in both of the divisions may be putting together hugely complex, comprehensive plans that actually can be complemented with each other. If the social worker is focusing on the supportive benefits of the WorkFirst program and that are available to the client, sharing that information via assessment with the Children's Administration worker who is working on the child protective and or placement aspects of that case.
I think a great way to create a relationship is to, with the different agencies, is to have a representative from Children's or a representative from WorkFirst come to maybe a unit meeting, you know, come over and spend half a day working on the other side to kind of find out what WorkFirst is all about. There's a lot of different pieces in WorkFirst, and there's a huge umbrella that we look at under Children's. And so to be able to identify some of those things, be able to figure out what one person is doing in WorkFirst, it's all about work, and what are the barriers to work and getting them back to work, whereas Children, it's about child safety. And so how do we get together and figure that out? And I think some of the best ways to do that is personally.
As a children's social worker, the benefits I get working with the WorkFirst program specialists or even just the financial workers on the CSO side is I can maybe find out where their last known address was. Maybe there is an emergency contact that they have so that I can help track down the families and maybe, you know, look at working with those families, the extended families, so that maybe the kids that we've taken into foster care can be placed with relatives.
When I collaborate with Children's Administration, they're able to give me information about activities the client's already doing, like if they're already in mental health, if they're already participating in chemical dependency treatment, things that's important for me to develop my case plan. Alternately, I'm able to provide them information about updated phone numbers, addresses, contact information, changes in their circumstances, anything that might have changed that Children's may not be aware of.
I have an example of kids actually being taken without permission by their parent. It was a reunification. Mom had had kiddos back for about a month and absconded with them, but she had had her benefits reinstated prior to her receiving the kids back into her home. And so we were able to collaborate with the CSO to see where it was that she was using her EBT card. And it took a little while, but we were able to locate her out of state actually, and then put enough of the pieces together to actually have law enforcement go in and get those kids safely back here.
I think the biggest benefit of working together for the client is that it lowers their stress and frustration, which in turn lowers our stress and frustration.
The CSO is looking to have the client overcome barriers. Children and Family Services is looking for the same thing. And so if we're all working together, one plan, the client is going to succeed.
If we shape our interventions and our plans and our services and what we're requiring of that parent, keeping in mind that child, that we know that with the addition of the supportive services, we can increase their safety, we can make sure they're fed, make sure they're housed, and give the parents the tools to be the parent that they want to be. That's the true benefit.
I was working with this family, so I contacted the WorkFirst program specialist, and we had placed the children in with some relatives. And the relatives weren't going to be able to get cash assistance because the children were undocumented. So the WorkFirst program specialist and I worked together in obtaining how can this family get some cash assistance to care for these kids. And we figured it out, and we, applied for Social Security numbers. I gave them the information, and they've opened up the non-ED TANF grant for the family so that they can help care for these kids while the parents are out doing what they need to do and keep so that the kids are safe.
About a month ago, a CPS worker had called me and asked me if I had any information on the father of the child. They were having a hard time locating the father of the child. So I was able to look in one database. I found the name of the father. I was able to look in another database and discover that he was paying child support payments. So then I connected the CPS worker with the Division of Child Support worker. We were able to locate the father. We reunified the child with the father, and CPS did not need to take that child into dependency or foster care at all. So it was very fast. We were able to locate the dad, close the case, done.
We were actually sitting in a Child Protective Team service meeting at the White Center Community Service Office. We had WorkFirst case management staff and social workers there at the same time. The Children's Administration and other community providers were there. Children's Administration was at the end of their process and fantastically considering returning that child home. And we were having challenges with transportation and childcare. At that table, we were able to work out all the transportation and childcare issues that were required and needed for that parent to be successful in attending mental health counseling and parenting classes. The parent who was sitting at the table with us was enormously relieved to see that the Children's Administration and Community Services staff were there in a helping, in a supportive, and in a efficient way in making sure that those services were available. And ultimately, the outcome was that child was returned. The household stabilized, the child was safe, the parent was happy, and it was a great outcome.